Hello, I am Dr. Harsha Reddy, obstetrician and gynecology, consulting in Cloudnine Hospital, Bellandur. So what is high-risk pregnancy? Any situation or a deviation from normal which happens in a pregnant woman which adversely is going to affect the health of the mother or the baby is called as a high-risk pregnancy. Preeclampsia is associated with abnormal placental development, as I have been repeatedly telling about, or an immunological factor which leads to narrowing of the blood vessels supplying various organs of the woman's body. So definitely it's going to give rise to complications in the woman. So let us talk about what are the complications the woman might have. She might throw a convulsion. Convulsion is called as a fit either during pregnancy, during labor or after delivery, which is called as eclampsia. Second complication can happen related to the kidneys. She might start passing less amount of urine, small quantities of urine, and it can go to a stage where there can be a complete renal shutdown, like because of acute tubular necrosis. These are the terms which we use, or acute renal failure, or in common term it is called as a temporary shutdown of functioning, of the kidney. Third is when the liver is affected. Now this is one of the severe complications which can happen. It is called as the HELP syndrome, where there is a massive breakdown of the red blood cells in the bloodstream of the woman. The platelet counts start falling, leading to clotting problems, and the liver enzymes will become elevated. Then she can develop visual disturbances like blurring of vision, dimness, but it can also progress to even a complete blindness. Of course, this is extremely rare, and we see even after a convulsion, we see it very rarely. Only 10% of women who have had a convulsion can develop a complete blindness, but it can happen. But this blindness is also completely reversible. Within about 4 hours they regain their vision, or maximum within a few days they regain the vision. So this blindness happens because of the vessels which supply the artery, called the retinal vessels, or due to certain changes in that portion of the brain which is controlling the eye. The other complication is called as a placental abruption or the accidental hemorrhage. This is when the placenta separates or gets pulled away from the wall of the uterus, and this gives rise to pain, abdomen and bleeding, and the baby's movements become very less. Normally, the placenta has to separate from the wall of the uterus only after the delivery of the baby, because the baby is getting all the nutrition it requires from the placenta. Now in this situation, if the separation is going to be happening when the baby is inside the uterus, it is catastrophic because the blood supply drastically gets cut to the baby. And even if we take an emergency measures to rescue the baby, we may even lose the baby. The woman might come, by the time she reaches the hospital, the baby would have died, or it might die in utero itself. The worsening maternal condition sometimes warrants us to take a call where we have to deliver the woman much before the due date, which is called as a premature delivery. And then the chance of cesarean section, so the operative interference also increases on the woman.